So, I encourage anybody who has other kinds of just more routine kind of health concerns, your physician office, one of the clinics, are always probably the first place to start. And if they feel that you really need more emergency care, they'll certainly direct you there. But if you are having, if you're having respiratory breathing, or you've chest pains, or any of those kinds of big issues that do need to be seen in an emergency department setting. And while it's not used for critical care, but for things like if you've really, if you've done something and you're concerned you have a broken bone or something, a lot of people don't realize if you go on the hospital website, there's a program called In Quicker, and you can actually schedule an ER visit. They show you the open slots, and so you can sign up right there, and so you don't necessarily have to sit in the emergency department 3 hours waiting. You can kind of say, oh, there's an 11 a.m., I'm going to sign up. Now, what I always do caution people and say, emergency departments are always going to take care of the most critical cases first. So if there's an accident on Highway 49 and you've got your 11 a.m. and that accident's coming in, they're obviously going to take those, those people first. But for a lot of people, it just, it lessens the need to kind of just sit in a waiting room there. So especially during something like this, it's a good way if you have to go to the ER and it's not critical or acute or, life-threatening, that you can do it without having to necessarily sit in the waiting room.
That's a very, very cool little side topic I'd like to delve into just for a minute here. Is that appointment system, is that new to COVID era, or has that been something you've been rolling out for years?
Yeah, it's been there for a couple years. The hospital launched it a few years ago, and then quite frankly, there were some glitches in it, and so they kind of took it off for a period of time till they got the glitches worked out, and then they put it back up. So it's been up, I think, again for a couple years. It's just one of those best kept secrets that, I try to put out in the union, or I try to make sure that people know about it. But, it's one of those things that, it's not top of mind if you don't need it. So, it's just kind of, I just constantly like to keep saying it. So hopefully it just sticks in someone's mind. So someday when they do have that emergency situation, they go, I think I heard about something once at the hospital has, and they remember it.
It's just a perfect example of how tech slips into every aspect of daily life.
Absolutely.
It's not the doctor, it's not the tool, it's not the medicine, it's scheduling what time you're going to be there. And you don't even think about it, but that could make it so much easier and take a lot of the stress out of, oh my God, I broke my finger. What am I going to do?
Absolutely.